This is Sil. I'm going to take you on my journey through breast cancer. I started recording, and I first have to give you a little bit of an update. I started recording this, just kind of testing it out, and I don't know if I'm going to keep it or not, but if I do, keep in mind I have a sense of humor, but I don't know if other people do or not. But I was using Zoom, and I had set it up a long time ago uh, for virtual effects where it would draw in eyebrows because at the time I didn't have any eyebrows because I lost all my hair. And I have Zoom meetings every week that I facilitate with family members. And so I had it draw in naturally my eyebrows. Well, anyway, I didn't know that was still on. And when I looked at my review of the video, the eyebrows are just flickering all at the top of my glasses, just going ching, 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 ching at the top of my glasses when I look up and down there, here and there, and there and there. So that's why I'm preface, that's why I'm telling you beforehand that keep your sense of humor. Okay? That's what you got to keep when you're going through anything. Sense of humor. And don't be distracted. Hey, whatever. Be distracted by my eyebrows going on top of my glasses. Lordy, lordy, lordy. Anyway, that's just all I wanted to tell you at this point. I'm going to go get some rest and then you can watch the rest. Just ignore my eyebrows if you can. Hello, everyone. In April 2025, I was diagnosed with breast cancer. I had breast cancer in 2001. And after being diagnosed in 2025, that was a real surprise for me. So, what a shock. But anyway, now it's beginning of 2026 in January. And I just didn't feel real good. And I was not in a real good state of mind at the time it happened to even think of doing something as far as documenting, I guess you could say. And after I had my surgery, I had a mastectomy in June 26, 2025, and double mastectomy I decided to have. I had breast cancer in the right breast again. And since I'd had it before, it was suggested and I agreed that to go ahead and remove both breasts. And it also sort of whirlwind that um, I didn't know what to do. Talking to the surgeon, and he's saying they can do a reconstruction surgery immediately after I do my surgery, and the doctor will be standing by. And it's a doctor that her and I work together, and so she'll be right there. And then he sent me over to see her almost immediately. I think it was that same day. And I went into her office. Actually, it was later because I took my sister with me, thinking maybe it'll help, for her to remember some stuff because I didn't know where my brain was, but she was a little overwhelmed too. So anyway, and so I went to the doctor like a few days later, and the plastic surgeon, and just it was like this. I was just like, whirlwind, whirlwind. What is she saying? Blah 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 blah. And I went, I don't know. I don't know anything about reconstruction surgery or implants at all. Never even thought of it. And and so it's like the only question my sister asked was, will the insurance cover it? And she's kind of said, obviously she doesn't handle, doctors don't handle insurance. They don't know. So um, she just kind of bypassed that with, I don't know, you'll have to check with the your insurance or something. I don't even know what she said. So anyway, again, the whole whirlwind. Then feels like it was like a month later before they could get the surgery done on me. The whole time I'm thinking, oh my gosh, this thing's growing. It's growing and growing and growing. And I looked on the document and it said stage 1. Doctors don't really say stage 1, 2, 3, or 4 when they're talking to you, just so you know. I guess they don't want to cause you to go into a um, thought of good or bad regarding your breast cancer. I have no idea. But he said it was a type of breast cancer that's, hey, it's a good one to have if you're going to have it. That's weird. In retrospect, at the time, I went, oh, that's good. And then he said, because it can be targeted. Um, the treatment afterwards can be, it can, it can target this particular kind, which was, by the way, HER2, HER2 positive, meaning it's positive for the hormones estrogen and progesterone. And anyway, that said, he said that's a good if you're going to have a cancer. That's a good one to have. Never a good one to have, just so you know. So going back, I picked some kind of, I went, I guess I'll have that one, and she wasn't much help. It was weird as far as the kind of um, implants that I would have. And then during the surgery, they had to take my nipples. And I thought, well, she'll reconstruct the nipples. No, just a straight line. Actually, it wasn't even that straight. It was not fun. I'm not going to go through all the details of what I had to go through after the surgery at this time, perhaps later on. Well, anyway, I did decide at that point, it was around the time of the surgery, and I was going through to go through the surgery, I was started taking pictures with my camera for a documentation of what I was going through. And then today, I don't know, I was thinking, you know what? I need perhaps to do a video of uh, my life as I was diagnosed with cancer and what I what I did and how it happened. Okay, so I after my surgery, I was sent to an oncologist. The oncologist said that I would be having chemotherapy treatments for 3 months or 12 weeks, once a week. So the first chemo treatment I had, I still had some hair, my own hair. And while I was there, I thought, I'm going to take a picture of myself. So I did a selfie and I looked at the selfie, and this is the shirt I was wearing. And this is the scarf I had in my real hair. Right now I have on a old wig I had from 2001. Kind of doesn't really look like my hair did at this point because I had a little gray in it now, but this wig doesn't. Don't worry about that. Pretend like it's my real hair. It has a little bit of gray, but mainly brown, dark brown. And it was curlier, my real hair. Okay. But anyway, I decided to reenact what I looked like the day I had my first chemo for this first episode. And I decided, I don't know why, I put on all my bracelets that I had. I had some that were from before that I found that, like for breast cancer, and then my breast cancer bracelet I found, which I had saved over the years. I also wore the same earrings. I don't know why, but I put on my leaf earrings. They're my leaf earrings. You can see that. Okay. I bought those when I thought I had Parkinson's. I was diagnosed with Parkinson's, and it turned out to be a rare disease called orthostatic tremors. And so now I just use them as my, yeah. So leave me alone earrings. I like to make jokes. Okay. My first chemo treatment, they had to use it in the drip system slower, and then had to sit for 30 minutes afterwards just to see if I had any reactions to it. So it took like, I don't remember, 2 hours, 3 hours, 3 hours perhaps. And my husband, John, took me to the place and stayed in the waiting room or went shopping and then came back to the waiting room to wait for me. He had a long wait. He's very good to me. Anyway, I was afraid that I would have really bad side effects, and I didn't really have it. Um, they have different kind of medicines nowadays that they didn't have in 2001, but they're still using some of the ones they used on me in 2001, which the lady next to me was using, and she called it the Red Devil because it was red. And it's the one that immediately gets you. You have horrible side effects and you lose your hair immediately. I didn't lose my hair that first time or the second time. It was like the third week maybe that I started really kind of losing my hair enough to wear a wig. That's pretty much the gist of it. Okay. Um, Prior to having my first chemo treatment, like a week before, I feel like I I had a port, and if you can look right there, can't see it. Can't see it real well, but right here, it's got, if you rub it, which you can't, but I can. Anyway, it's got like one, two, three or four little knobs on it that they can hook into to do the treatments on. I had that surgically implanted right here with a lead going up here to my neck area and then straight into my heart. Very scary. And so it goes into my heart. Not a fun time, and you try not to think about it. When you go into the treatment room, there's like 4 rows of kind of like hospital looking chairs that recline, the feet recline. The back doesn't really recline, but I've seen people laying down. And I guess if you stretch out real hard and you have your feet and your hip, I don't know how they got it to recline on the back as well. But I saw, especially men, I don't know why, maybe they were in a worse shape or something, reclining completely and asleep even, during their treatments. But they just say, go pick a chair. And I had no idea. So I went and just found a chair. Everyone was very nice. The nurses come in and introduce themselves, and then they say what they're going to do, ask you your name, of course, and your birthday. And my heart rate was very fast. Almost every time I went in, still going, still faster because of mine. I get anxious. It's a very anxious type of thing. And then when you get in there and you see the people scattered throughout, it's according to, sometimes it's more crowded than others, but there's at least 10 to 15 people, men and women, all ages, in the chairs with the bags dripping into either their veins or their port. And I sit down. They have like pharmacists behind this wall with a mirror with the windows on it. And so these nurses take my prescription that the doctor had given them for what I'm going to have dripped into my system to this pharmacy behind the wall. They fill the prescription, put it in the little bags that go onto I don't know the names of any of this stuff. Goes into the device that they hook it on. And then that takes about 15 to 20 minutes for them to do that. Well, during that time, and I'm sitting there waiting for sure. Of course, during the whole thing, I'm thinking this, but there's such an overwhelming, for lack of knowing what to call it, on me, was like empathy for all these people around me, knowing that they all have cancer and that they're going through what I'm going through, maybe even worse. And it was just like very easy to get depressed and extremely down. Almost feel like you want to have a panic attack if you have those, because like you don't want to be around all this. But I tried not to think about that. I tried to just absorb the fact that I was having empathy for all these people and that I was feeling the cancer all around me, and let that go into me and feel for these people and hope that these people will be okay. And then drop that. I had to drop it. Every once in a while, it comes back to you, just see them or hear them talking to people or whatever, or just laying there or sitting there. I smiled at people if they'd looked at me. May have said hi. I don't remember the first time. But it didn't really hit me the first time. I was still kind of, as far as me, I was kind of, I don't know if it's like in denial, but sort of. And I just let things happen as they happened. And I had brought some Bluetooth earplugs to listen to podcasts and stuff on my phone. And as I started listening to them and the medications they give you, what they call pre-meds, kind of make you loopy, is the word I use. And so when I started getting loopy, I couldn't concentrate on that stuff and I couldn't listen to it. So I had to turn that off. So I'm just kind of sitting there in the loopy stage, kind of looking around. That's pretty much it. The main thing for me in the chemo room, treatment room, is realizing how much cancer there is out there in the world. And this is only a handful. This is only like a needle in the haystack, because there's these places all over the place. That's just the facility I was in, that people have cancer and have to have all these horrible chemicals pumped into them, which, for you that don't know anything about chemo, I was getting chemo and a little bit of immunotherapy as well, a small dosage of it. The chemotherapy was mainly my main thing, and chemotherapy attacks every cell in your body and your immune system, so that your immune system, I guess, is reacting wrong, and therefore it's causing these cells to grow. And I'm not a doctor. I don't explain things probably correctly. It's just the way I envision it, understand it in my own way, my own layman way. Okay. So the cancer cells, I feel like, are being attacked by like your immune system. And these cells divide and grow and kill the original cell that was in there and become cancer cell. So chemotherapy doesn't know which cell are cancer and which ones are not. So it attacks your immune system, says your immune system can't go to those cells and keep growing and eating it up is what I call it. And so it's sort of like that. And the fact that it does that, that's why you lose your hair, you get sick to your stomach, you have all kinds of side effects because it attacks everything in your body. You have to drink lots of fluids, they said, which believe me, I do. Still need to do it. And hold on. Whether you're thirsty or not, you have to gulp it. And it helps clean out your kidneys. Because this stuff can kind of sit in your kidneys and destroy those. So it's one of the things. So they want to wash everything in your system, every organ. This meds, these horrible chemo meds that are going through your body. You've got to drink all this water, especially water, but liquids, they said, is fine, but lots of water. Not coffee or tea or things with caffeine in them. Something like water to help wash this stuff out of your system, and it doesn't settle and injure your organs and whatever. So, kind of weird, because you start thinking, okay, if I'm washing all this stuff out, I hope there's still enough in there to do its job. That's the way my mind thinks. So weird. I don't know. But anyway, so I've been doing that because I certainly don't want to have to go through like dialysis or something because my kidneys get ruined by the stupid chemo. We're going to all say hi, and I hope you get to feeling better. This is Sylvia.
Hi, Andy.
Hi.
Hello, Andy.
Hi, Andy. Say hi.
Hi, Andy.
We love you and miss you.
Hope you get better soon.
Yes, get better. We love you. I didn't know if I told you, but my first treatment was July 30th, 2025. And it was really worse than it should have been for me, which I didn't mention because that day is the day my sister, my older sister who lives in Texas, I live in Arizona, died that day. Same day I was having my first chemo treatment. Anyway, my sister who died, her name's Andy, she had to go through dialysis. And when I mentioned dialysis, that reminded me of that because her kidneys failed quite a few years ago. They didn't know why. And then maybe a couple of years later after that, she found out she had multiple myeloma, which is a blood/bone cancer. And in retrospect, and her daughter Denise and I looking up what that was, they said a lot of times it manifests as kidney issues in the years before the multiple myeloma shows up in your blood to be determined that you have multiple myeloma. So we think maybe that might have been why she had kidney issues and had to have dialysis. Anyway, and then when she got multiple myeloma, she went through treatments. Now she lives so far away and nobody there really knew a whole lot about what she was getting, and they didn't ask. So I'm assuming she was getting chemo as opposed to immunotherapy. I really don't know. Maybe she started off with chemo like me and then started the immunotherapy. But I did look it up later, and they do use the targeted immunotherapy, or at least immunotherapy, like I guess forever when you get it. She started getting dementia. I think personally, because in multiple myeloma, your blood thickens. And I think when your blood thickens, you don't get as much blood to the brain, which means oxygen to the brain. And I think that's why she started getting dementia. She was in her upper 70s. And close to 80, maybe she was 80 actually when she died. But it's too much coincidence as far as I'm concerned that she had multiple myeloma and started getting dementia. Because, I mean, my brain thinks like that. My brain is constantly thinking, what caused this? I ask questions all the time, and I look up things while I'm doing something else on the computer. Like I play word games in the morning, keep my mind going, and I think, oh, I wonder if blah, blah, blah. And on the other screen, I'll ask a question about multiple myeloma. Is this a symptom? What happens to your blood? All that kind of stuff. And that's, again, my interpretation as to why she got dementia, is her blood was thickened and she wasn't getting enough oxygen to her brain. She wasn't drinking water like you're supposed to. I tried to get her to drink water like, this is before I got sick, but I just know that you need to hydrate yourself when you're going extremely, when you're going through treatments like that. Because I had it 4 years ago. And I know you have to drink a lot of fluids. People should drink, when they're older especially, lots of fluids, because your body, especially as you get like past 50, I think, it's pretty early. Your body doesn't know you're thirsty and doesn't tell you, hey, you need to drink water because you're thirsty. It just kind of somehow forgets that you're thirsty, and you have to make yourself drink the water. And whether you're thirsty or not, drink the water, drink it all the time throughout the day as much as you can. I can't say it enough. People need to do that, especially as they get older. It's good for your body. As you get older, it's easier for you to get things like kidney issues or kidney disease. Definitely want to drink a lot of water to help flush out your kidneys all the time, that kind of stuff. Oh my gosh, I'm getting on a pedestal and telling people what to do. Keep that in mind. I like to help people before the fact, before they get something wrong with them. And they don't realize that, hey, this was probably helping me. Okay, you can't stop the cancer though. Once you're getting cancer, that's all there is to it. I don't know how it happens, how mine happened. I don't know. I don't know why my background is blurred, but oh well. In the background, you can kind of see there's actually a quilt on the back. It's pink and red and white and off pink, light pink, dark pink. That was given to me 24 years ago when I had cancer by my family, the Alexander family, when I went to the Alexander reunions. And in 2001, 2, whenever I went, and I had a scarf on my head. They, of course, knew I had cancer by that. And they secretly made little pieces of cloth when I wasn't around and wrote something on it to me. And one of my cousins, Jan, she took all those pieces of cloth that people wrote on and then took other cloth and made a quilt out of it without me knowing it. And then the next time we had a reunion, which was, I don't know, about 4 years later, 2 years later, I was presented and surprised with this quilt at the reunion. And it's right by my treadmill there. I get on the treadmill every once in a while now that I can. I couldn't do it during chemo. I was way too weak. But anyway, and so when I'm on there, I can see some of the writings on there. And when I read them, I cry to this day, happy tears. Anyway, that's what is in my background there. Right now, though, I'm one of the younger of the like 50 cousins that I have. And so all of my aunts and uncles, except for 2 on my Pickett side, my dad's side, everyone's gone. I have my Aunt Ruth on my dad's side. She lives in Salem, Oregon, and she's 100, will be 101 in a few months. And then there's my Uncle Bill, who lives in Phoenix. And I don't know, I feel like he is 88 or 89. I think he'll be 89 this year. And anyway, got sidetracked again, but all the family members not being here, but a lot of the cousins are dying. We don't have that aunt and uncle that brings together and the reason for our family reunion. So we haven't had one in years. In a way, I was lucky that I had the cancer the first time during that time, and I got this as my support. I don't have a support group right now. So that's why I'm coming on YouTube and maybe a podcast as well. I do have a YouTube channel that I'm going to try this, my journey through breast cancer. And I had my treatment. This is Saturday. I had it on Wednesday. Takes me about 3 or 4 days after the treatment to be feeling really good. But, and not going through a little bit of what I call fatigue, but I also get brain fatigue. That's what I'm getting right now. So I may have to stop this for now because I'm getting that brain fatigue. And they say rest. If you make sure you get up and move, but if you started getting like this, go rest. Rest is just as important as exercising or moving around and drinking water. So I'm going to stop this for now. And toodaloo.